Pericardial mesothelioma is an extremely rare form of this already rare cancer. It accounts for just 1 to 2% of all mesothelioma cases, and that means there are only maybe 30 to 60 cases per year in the entire United States. It's so rare that most oncologists will never see a single case, and it's even unusual for mesothelioma specialists to see it. It's also particularly dangerous and often fatal within months of diagnosis. Today, I want to explain why pericardial mesothelioma, what it is, why it's so rare, and what the available treatment options are. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding this rare disease variant is important for anyone diagnosed with it. Let's start with what pericardial mesothelioma is. The pericardium is the thin, double-layered membrane that surrounds the heart. Like the pleura around the lungs or the peritoneum that lines the abdomen, the pericardium is made of mesothelial tissue. Pericardial mesothelioma is cancer that develops in this membrane. The pericardium has two layers, the visceral pericardium, which is directly attached to the heart surface, and the parietal pericardium, which forms the outer sac. Between them is a small space called the pericardial cavity that contains a tiny amount of lubricating fluid that allows the heart to move smoothly as it beats. Pericardial mesothelioma causes tumors to grow on the pericardium. It thickens the membrane, and that often causes fluid to build up in the pericardial cavity. This is called pericardial effusion. The fluid buildup compresses the heart, restricting its ability to fill with blood and pump effectively. Why is pericardial mesothelioma so rare? The answer relates to how asbestos exposure typically occurs and where its fibers tend to accumulate. The overwhelming majority of asbestos exposure happens through inhalation, breathing in fibers that become airborne. These inhaled fibers naturally accumulate in the lungs and pleura, which are the tissues they encounter first. That's why pleural mesothelioma accounts for about 75% of all cases. Now, some asbestos fibers that are inhaled can migrate through the lymphatic system to the peritoneum. That's one explanation for peritoneal mesothelioma's 20% share. Other asbestos fibers could be swallowed and reach the peritoneum through the digestive tract, or it can be the result of using asbestos-contaminated talc in the vaginal area for personal hygiene. But the pathway for asbestos fibers to reach the pericardium, it's much less clear and presumably much less common. Researchers have theorized that the fibers may migrate from the lungs through lymphatic channels to the pericardium, or they may travel through the bloodstream to reach the heart lining. Whatever the mechanism is, it clearly happens much less frequently than migration to the pleura or peritoneum. Unfortunately, as extreme rarity, it means that there's limited research on pericardial mesothelioma. Clinical trials typically don't enroll enough pericardial patients to draw specific conclusions about this variant. So treatment approaches are often extrapolated from what works for pleural disease rather than being based on specific evidence about pericardial mesothelioma. Now, I want to take a quick break here and ask you a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end. I'm going to give you valuable information on where to find resources that will make a real difference for you. So, why is pericardial mesothelioma so dangerous? Several factors contribute to its particularly poor prognosis. First, the location is immediately life-threatening. While the pleural and peritoneum can tolerate a big tumor burden before its critical organs that are nearby fail, the pericardium directly surrounds the heart. Any significant tumor growth or fluid accumulation can immediately compromise cardiac function. Pericardial effusion, the fluid around the heart, can cause cardiac tamponade, which is a medical emergency where the fluid compresses the heart so severely that it can't pump blood effectively. This requires emergency drainage and can be fatal if not treated immediately. This means pericardial mesothelioma can kill quickly through direct mechanical interference with the heart. Another dangerous aspect of the disease is that its diagnosis is often extremely delayed. The symptoms of pericardial mesothelioma are vague, and they mimic many common conditions: chest pain, shortness of breath, irregular heartbeat, fatigue, and cough. These are all symptoms that could indicate dozens of different problems. And even when pericardial effusion is detected on imaging, the initial assumption is that it's caused by infection or inflammatory conditions or other more common cancer causes, not cancer. By the time pericardial mesothelioma is diagnosed, the disease has often significantly progressed. Many cases are only diagnosed on autopsy after the patient has died from cardiac complications without the underlying cause having been identified during the victim's life. Treatment options are also extremely limited. For pleural and peritoneal mesothelioma, surgery to remove bulk disease can be beneficial for appropriately selected patients. But surgery on the pericardium is far more complicated and dangerous because of the proximity to the heart and its vessels. Pericardectomy, which is removal of part or all of the pericardium, is a high-risk procedure, and complete removal of all the tumor material is virtually impossible when the disease involves the surface of the heart itself. The symptoms of pericardial mesothelioma clearly reflect its effect on cardiac function. Chest pain is common, often described as sharp or stabbing, and it's worse with deep breathing or laying down. This is called pleuritic chest pain, and it reflects irritation of the pericardium. Shortness of breath develops as fluid accumulates and restricts the heart from filling, and irregular heartbeat or palpitations can occur as the disease affects the heart's electrical conduction. Fatigue and weakness result from reduced cardiac output. Cough, sometimes persistent, may develop, and swelling in the legs or abdomen can occur as heart failure develops. These symptoms often come on relatively quickly and they worsen rapidly, unlike the more gradual onset typical of pleural mesothelioma. Diagnosis requires imaging and often requires invasive procedures. A chest X-ray may show an enlarged cardiac silhouette if significant effusion is present, and an echocardiogram, which is essentially an ultrasound of the heart, it's usually the first test that clearly identifies pericardial effusion and can assess how it's affecting heart function. CT scans or MRIs can show pericardial thickening, masses, and the extent of the disease. Pericardiocentesis, which is needle drainage of the fluid, can relieve symptoms and provide fluid for analysis. But diagnosing mesothelioma from fluid alone is difficult. We've discussed this before. Biopsy through what's called a pericardial window, where a surgeon creates an opening in the pericardium, is often what's needed to obtain a definitive diagnosis. Treatment options are limited and mostly palliative. Pericardiocentesis to drain the fluid provides temporary symptom relief, but the fluid typically reaccumulates. Pericardial window surgery creates a permanent drainage pathway and can prevent dangerous fluid reaccumulation. And chemotherapy or immunotherapy combination, those are the same regimens used for pleural mesothelioma. It may slow the disease's progression, but honestly, responses are generally poor. Radiation therapy to the pericardium may provide some tumor control and symptom relief. Pericardectomy, which is removing part part of the pericardium is available, but it's rarely performed due to the surgical risk and limited benefit. So the prognosis for pericardial mesothelioma is grim. Median survival from diagnosis is typically measured in weeks or months. Some patients survive less than a month. Long-term survivors are extraordinarily rare, though there are occasional reports of patients who've undergone aggressive treatment surviving a year or more. From a legal standpoint, pericardial mesothelioma cases are treated the same as any other mesothelioma type. Patients and their families can pursue compensation through lawsuits and trust fund claims based on asbestos exposure. The extreme rarity of the condition doesn't affect your legal rights, and the particularly poor prognosis and loss of quality of life may actually influence damage awards in wrongful death cases. To review, pericardial mesothelioma is extremely rare. It's only 1 to 2% of all mesothelioma cases, and the pathway for asbestos fibers to reach the heart lining is unclear and uncommon, and the disease is particularly dangerous because tumors and fluid directly compress the heart, causing rapid symptom progression and cardiac emergencies. Treatment options are limited, and prognosis is measured in months if you're lucky. Diagnosis is often delayed because symptoms mimic common conditions. If you have cardiac symptoms and a history of asbestos exposure, make sure your doctors consider this possibility. And you can visit mesothelioma.net for information about this condition or call 1-800-692-8608 or use the live chat feature to speak directly to one of our patient advocates. As for me, remember to post your questions below, and I'll see you next time.